Have you ever taken a pill your doctor said would fix your prostate, only to notice that a few months later, you just don't feel like yourself anymore? Maybe your energy isn't the same. Maybe intimacy feels different. Or maybe you can't quite explain it, you just feel off. You're not imagining things, because for millions of men over 60, common prostate drugs like Tamsulosin and Finasteride do help the bladder, but they can quietly change the way your body behaves, your mood, and even your confidence. I'm Dr. Emily Carter, and in today's episode of Men's Vital Health, we're going to talk openly, not fearfully, about what these medications do, the side effects doctors don't always have time to explain, and what smarter questions you should be asking at your next checkup. Because knowledge is power, and your health, your vitality, and your masculinity deserve honesty, not half answers. So let's start from the beginning. Why these pills are prescribed, how they work, and what happens when you've been on them for a while. Understanding the problem. Let's be honest. For many men over 60, life changes in ways you never expected. You've worked hard all your life, raised families, built careers, and now, when you should be enjoying peace and freedom, your body starts sending you signals that something isn't quite right. You wake up 2, maybe 3 times a night just to use the bathroom. You stand there, waiting for the flow to start, and when it finally does, it feels weak, incomplete, like your body's betraying you in slow motion. You tell yourself, maybe it's just part of getting older. But deep down you wonder, is this really how it has to be? That's the moment most men visit their doctor, and often they hear the same words. You've got an enlarged prostate. It's called benign prostatic hyperplasia, or BPH. Now, the prostate itself is a small gland about the size of a walnut, but when it swells, it squeezes the urethra, that tiny tube that carries urine out of your body. And suddenly, something that used to happen automatically becomes a nightly frustration. Doctors prescribe medications like Tamsulosin or Finasteride to relax or shrink the prostate. And for many men, the results seem like a miracle at first. You sleep better, the pressure eases, and that endless urge finally calms down. But here's where the story takes a turn. And it's the part most people never talk about. Because while these drugs can relieve one problem, they can quietly create new ones that are harder to notice, at least in the beginning. Changes in energy, mood swings that sneak up on you, a dip in motivation, drive, or intimacy that you can't quite explain. And for too many men, these symptoms are brushed off as just aging. But are they really? Or could they be connected to the very medications meant to help you? In the next part, we'll break down what Tamsulosin and Finasteride actually do inside your body, and why understanding their mechanism is the first step to taking control of your health again. Because when you know what's happening beneath the surface, you stop being just a patient and start becoming an active partner in your own well-being. What these drugs actually do. Before we talk about side effects, it's important to understand why these medications are prescribed in the first place and what they're actually doing inside your body every single day. Doctors generally turn to 2 main types of prostate drugs: Tamsulosin, often known by the brand name Flomax, and Finasteride, which you might recognize as Proscar or Avodart. At first glance, they sound like they do the same thing, but in reality, they work in completely different ways. Let's start with Tamsulosin. Think of your prostate and bladder like a water pipe with a valve. When the muscles around that valve tighten, the flow gets restricted. Tamsulosin works by relaxing those muscles, like gently loosening the valve, so urine can pass through more easily. That's why, for many men, the relief comes quickly. Within days, you may notice a stronger stream and fewer nighttime trips to the bathroom.
But here's the catch. Because Tamsulosin also relaxes blood vessels, it can sometimes cause your blood pressure to drop suddenly. That's why some men experience dizziness or feel lightheaded when standing up too fast. It's not your imagination, it's your circulation adjusting. Now let's move to Finasteride. This one works more slowly, over months rather than days, and it targets something deeper, your hormones. Finasteride blocks the conversion of testosterone into another hormone called DHT, or dihydrotestosterone. DHT is what makes the prostate grow larger over time, so by lowering it, Finasteride helps shrink the prostate, reducing pressure on the bladder and improving urine flow. Sounds helpful, right? And for many men, it is. But the body is a delicate balance, and when you lower DHT, you're not just shrinking the prostate, you're also changing part of what fuels energy, mood, and sexual function. That's why some men report feeling tired, less interested in intimacy, or notice that erections aren't as firm as before. It's not weakness, it's chemistry, and awareness is your greatest protection. When you understand the why, you stop blaming yourself. You start realizing that your body is responding exactly as science would predict. And that's the moment real control begins. In the next part, we'll explore what happens when these drugs are used long-term, the side effects that can sneak up slowly, and how to recognize the early signs before they take a toll on your confidence or vitality. Because the more you know about what's happening inside, the more power you have to protect what matters most: your health, your energy, and your identity as a man.
The hidden or overlooked side effects men should watch for. Now that you understand how these drugs work, let's talk about what many men don't realize until months or even years later. Because while the relief they bring can feel life-changing at first, some of the changes they cause inside the body can be easy to miss until they quietly start to affect your energy, your emotions, and even your sense of self. Let's start with Tamsulosin. For most men, it's the first prescription after a prostate diagnosis. It works fast, and that's the good news. But because it relaxes blood vessels, it can also lower your blood pressure. That means you might feel dizzy when you stand up, or notice your vision blur for a second before everything steadies again. It can also cause headaches or a constant sense of fatigue, the kind where you feel like you've slept 8 hours but still wake up tired. And then there's something more personal, something most men are never told. Tamsulosin can cause what's called retrograde ejaculation. That's when semen travels backward into the bladder instead of outward. It doesn't hurt you, it's not dangerous, but it can be confusing, even worrying, especially when you realize climax doesn't feel the same anymore. Many men describe it as the body going through the motions, but the moment feels empty. Now, let's talk about Finasteride. Finasteride's changes are more subtle, hormonal, emotional, and long-term. Because it lowers DHT, it can also lower libido, reduce firmness during erections, and for a small group of men, trigger what's known as post-finasteride syndrome. What does that mean? It's when the side effects don't fully go away, even after you stop taking the drug. Some men experience lingering fatigue, brain fog, or mood changes like anxiety, sadness, or a kind of emotional numbness. It doesn't happen to everyone, but it's real enough that researchers continue to study it closely. Now, here's something important to remember. These reactions don't make you weak. They make you human. Your body is adjusting to chemical shifts it was never designed to handle for years on end. If you notice you're losing motivation, if you feel disconnected from your emotions or your partner, don't ignore it, and don't just blame age. That's your body's way of asking for attention, and it deserves to be heard. Because what truly matters isn't just living longer, It's living with clarity, energy, and the ability to feel fully alive. In the next part, we'll go deeper into the emotional side of these changes, because the physical effects are one thing, but the quiet impact on confidence, relationships, and identity, that's something every man deserves to understand before it takes more than it gives. The emotional side most men don't talk about. Now, let's talk about something deeper. Something most men never bring up in the exam room, not because they don't feel it, but because they've been taught not to talk about it. I'm talking about the emotional side of prostate treatment, the quiet changes in confidence, intimacy, and identity that these medications can stir beneath the surface. For many men, the physical side effects are manageable. A little dizziness here, a bit of tiredness there. But what really catches them off guard is what happens inside. I've had patients sit in my office and whisper, "Doc, I don't feel like myself anymore." They're not in pain, they're not sick. They just feel different. It's that subtle loss of drive, that missing spark that used to push you forward, the energy to take initiative, the interest in closeness, the simple pride in feeling strong and capable. When that fades, it can shake a man's sense of who he is. Because masculinity isn't just about muscles or performance. It's about feeling alive, having purpose, having control. And when a pill that was meant to help starts to quietly dull those things, the emotional toll can be heavier than anyone expects. You might start avoiding intimacy, not because you don't care, but because you don't want to feel disappointment. You might stop sharing how you feel with your partner, because you don't want to worry her or admit something's changed. And little by little, that silence grows into distance. But here's the truth, and I want you to really hear this. It's not your fault. You didn't do anything wrong. Your body is reacting to chemical changes, and that's a medical reality, not a moral one. So please don't suffer quietly. If you're noticing a change in how you feel, physically or emotionally, it's not a sign of weakness to bring it up. It's a sign of wisdom. Because men who speak up are the ones who find better solutions and reclaim their vitality in smarter, safer ways. In the next part, we'll talk about how to have that conversation, the right questions to ask your doctor, the safer adjustments that can protect your prostate and your confidence, and how to become a true partner in your own care. Because healing isn't just about treating the prostate, it's about restoring the man as a whole.
What you should ask your doctor. So here's where everything starts to change. Not in your medication, not in your age, but in your approach. Because the most powerful step you can take isn't found in a pill. It's found in a conversation. You see, so many men walk into the doctor's office and say, "Everything's fine." They nod, take the prescription, and walk out, without ever realizing they've just agreed to years of treatment without asking a single question that truly matters. But you don't have to be that kind of patient anymore. You can be an active partner in your health. And it starts with learning what to ask. When you meet your doctor next time, try asking, "Doctor, how long should I really be on this medication? What happens if I stop or reduce the dose? Is there a plan for that? Are there natural or lifestyle-based ways that could support my prostate, so I don't have to rely completely on medication? Can we review whether my symptoms are improving or if they're being masked?" These questions aren't confrontational, they're collaborative. And trust me, a good doctor will appreciate them because it tells us you're engaged, you're paying attention, and you care about your long-term health, not just short-term relief. You can also track how you feel between visits. Write down changes in mood, energy, intimacy, or sleep. Those notes might seem small, but they can reveal patterns your doctor can't see in a quick appointment. And if your doctor dismisses your concerns or says, "Oh, that's just part of getting older," don't be afraid to seek a second opinion, because your well-being isn't up for negotiation, and neither is your right to understand what's happening inside your body. It's time to ask better questions, to stop accepting side effects as your new normal, to remind yourself that you deserve not just to live, but to feel alive, physically, emotionally, and mentally. And once you start asking the right questions, you'll notice something powerful. You begin to feel in control again. You're no longer reacting to your health, you're actively steering it. In the next part, we'll talk about simple, everyday habits that can support your prostate naturally, from nutrition and hydration to exercise and hormone balance. Because medication is only one piece of the puzzle, and the rest is fully within your reach. Safer habits and natural support. So now that you know what these prostate medications do and what questions to ask, let's talk about something just as powerful. The things you can do every single day to support your prostate and your vitality naturally. Because medication should never replace healthy habits, it should complement them. And the truth is, many of the side effects men experience can be softened, even reversed, by simple, consistent changes in lifestyle. First, let's talk about movement. You don't need to lift heavy weights or run marathons. Gentle daily exercise, even a 20-minute walk after dinner, helps boost blood flow, balance hormones, and reduce the inflammation that can irritate the prostate. Movement is medicine. It clears the mind, strengthens the body, and yes, improves circulation down there. Next, hydration. Drink enough water, but time it smartly. Sip throughout the day and ease up a few hours before bed so you're not waking all night long. Avoid caffeine or alcohol in the evening. They irritate the bladder and make the prostate work harder than it should. Now, let's look at nutrition. Your prostate thrives on certain nutrients, especially zinc, lycopene, and omega-3 fatty acids. You'll find them in foods like pumpkin seeds, cooked tomatoes, salmon, walnuts, and olive oil. These help reduce inflammation and support hormonal balance naturally. And here's a small but powerful addition: green vegetables. They're full of antioxidants that help your liver clear excess estrogen, a hormone that tends to rise in older men and can aggravate prostate growth. But perhaps the most overlooked habit is stress management. Chronic stress tightens muscles in the pelvis, disrupts sleep, and raises cortisol, which in turn suppresses testosterone. That's a cycle that quietly chips away at energy, mood, and sexual function. So take moments each day to breathe, stretch, meditate, pray, or simply sit outside with the morning sun. Small rituals of calm have a powerful effect on your entire nervous system, and your prostate responds to that balance. Remember, none of this is about perfection. It's about awareness. Because once you know what your body needs, you start treating it with care, not frustration. And the amazing thing? Your body remembers how to heal. These habits don't just protect your prostate, they restore your confidence, your clarity, and your connection with life. In our final part, I want to share one message. A reminder that staying strong after 60 isn't about fighting age. It's about partnering with it. It's about understanding your body, respecting it, and taking back the control that so many men feel they've lost. Because growing older isn't the end of vitality. It's the beginning of wisdom, empowerment, and encouragement. If you've stayed with me through this conversation, I want you to take a deep breath. Because what you've just done is powerful. You didn't run from the truth. You faced it head on. And that's something I wish more men would do. Because real strength isn't in pretending everything's fine. It's in being honest enough to learn what your body is trying to tell you. Aging doesn't mean decline.
It means adjusting the strategy. Your body may need a bit more patience, a bit more awareness, and a lot more kindness, especially from you. If you're taking prostate medication right now, don't let fear control the story. Let knowledge guide it. Ask questions. Track how you feel. Be part of the conversation about your own health, because no pill can replace the power of an informed, confident man. And if you've noticed changes in your energy, your mood, your drive, remember, it doesn't mean something is wrong with you. It means your body is talking. And when you start listening with curiosity instead of shame, you'll find the answers come easier, and the solutions start to fit your life, not fight it. You've worked too hard, lived too much, and overcome too many challenges to let a pill define your story. This chapter, your chapter, is about taking back control, not just of your prostate health, but of your purpose, your confidence, and your spark. Because the truth is, life after 60 isn't about slowing down. It's about fine-tuning what matters and letting go of what doesn't. It's about living smarter, deeper, and stronger than ever before. I'm Dr. Emily Carter, and this is Men's Vital Health, where growing older means growing wiser, and every conversation brings you one step closer to living with energy, clarity, and peace. If today's talk helped you understand your health a little better, give this video a like, share it with someone you care about, and subscribe for more honest, science-backed conversations about living your best life after 60. Because no matter your age, your vitality, your confidence, and your joy are always worth protecting.